Welcome back, everybody. April is Esophageal Cancer Awareness Month in many states across the U.S. Hawaii has not officially proclaimed April as this Esophageal Cancer Awareness Month, but our next guests feel it is very important to raise awareness for this type of cancer. We welcome in Dr. Patrick Kenny and Dr. James Panetta with Windward Digestive Health Center. Hello, thank you both for joining us.
Hi, Judy. Thanks for having us.
Before we get into this Cancer Awareness Month, esophageal cancer is cancer in the esophagus, right?
Yes.
Can you explain to our viewers who may not know where is your esophagus and what its role is for our body?
Yeah, so the esophagus is the feeding tube. It's the tube that connects the mouth and throat with the stomach. And so when you eat and you swallow, it passes through the esophagus into the stomach.
Okay.
So it's that connection.
Okay. And tell us about Esophageal Cancer Month. Why is this important?
So it's one of the newer sort of designations for Cancer Awareness Months, and the reason it's we're trying to raise more awareness as GI societies is that esophageal cancer is unfortunately becoming more prevalent. We talked last month about colon cancer, where we're actually doing a good job decreasing the incidence of cancer. With esophageal cancer, the risk has gone up 30 to 40 times what it was back in the 1960s. So we're seeing an increase in the incidence of this cancer, and unfortunately, with esophageal cancer, almost 80% of patients who are diagnosed with this cancer, it's a fatal disease for about 80% of patients. So it is something where, unfortunately, we oftentimes don't recognize it until it's gotten really advanced. And the point of awareness is to raise awareness about the symptoms of the cancer so that people don't ignore those symptoms, come in and get checked out. We're like all cancers, if we can identify it earlier, we have a much better chance and much higher success rate at treating those cancers.
Okay, you mentioned symptoms. What are those symptoms?
So symptoms can vary. The most common symptoms are difficulty swallowing. Patients will sometimes will tell us that they seem like their food gets stuck. Also, painful swallowing can be a symptom. Occasionally, people will be found to be anemic just on routine blood work, and other times people are losing weight. But I think it's important to know that a lot of these symptoms, particularly the swallowing difficulties, that can sometimes indicate late disease, and so it may be there may be less of a chance to cure it at that point.
Okay, because people will put off going to the doctor. So knowing that, I mean, if they wait until they have trouble swallowing, I mean, what are are there any early signs that you can go in?
So what we're trying to do when we do screening for esophageal cancer, because there is screening available. It's done by way of an EGD, most commonly in this country. And an EGD is a procedure where we put a flexible tube through the mouth, down into the esophagus. We look in the stomach as well, but into the esophagus and actually look at the tissue there. That screening test is something that we definitely would do with anybody with symptoms concerning for esophageal cancer, but also patients with changes in acid reflux disease. So a lot of people suffer from heartburn, and not everybody with heartburn has esophageal cancer, but certainly if you've had heartburn for a very long time, and we think over 5 years, those patients should be considered for screening. Esophageal cancer affects men much more commonly than women, and more often in esophageal cancer we see it in Caucasian men who are overweight, over the age of 50, but anybody who's had reflux for a long period of time, over 5 years, should get screened early, and then people that are falling into some of those other risk factors should at the very least talk to their doctor about, should I get screened for esophageal cancer?
Okay, thank you for that. I did do a little bit of research, and I do remember reading that Caucasian males are more likely to have this. So thank you for sharing this information with our audience. Very important indeed.
Absolutely.
Thank you.
Thank you for having us.
Coming up on Living